Murikyo munene ase wizara y'obuchenu Daktari Oluga amo nababwatani bande au kurwa ase sekta y'obuchenu naboigo omurikyo butambe ase wizara y'obuerania omusike Stephen Isaboke omukonyi bw'omugavana we county ya Kisii omusike DG Obebo naboigo omudirector bw'obuteneneri ase wizara y'obuchenu James Intabo nigo batalira amagacho ye Cancer Centre imenye county ya Kisii elikorotota okugenderera kwaye Ninyagitari erabe nengenchenene uchase abanainchi anene orogongo orwanyanza abu barachikwenyorera obugwenia ase obuwange muno.
When was the foundation? We had a slow start.
That His Excellency the President, Dr. William Ruto, has given us to ensure that this project is completed so that it is responding to the needs of cancer in this region. As you know, we are having a huge cancer burden in this region: cervical cancer, breast cancer, colorectal cancer, esophageal cancer. And all of this, sometimes, of course, many people go to the neighboring Tenwek. Many people, as you know, go to MTRH. A lot of other people have to suffer in the buses in the night to go to Kenyatta National Hospital. And part of the decongestion is this. And from that perspective, we are also making sure that we pay for cancer care. As you know, we increased the package in the Social Health Authority so that we can make it easy for people to access care without financial burden. And we are keen to even make sure that that cost is reduced. You know that we have MOUs, that is Memorandum of Understanding, with even drug companies like Roche, where we have reduced the cost of breast cancer medicine from 120,000 to 38,000. This morning we were to meet with Pfizer again so that we reduce the cost of the medicines.
Like the PS Oluga said, my name is Stephen Isaboke. I'm responsible for broadcasting and telecoms, but I joined my colleague who is PS for Health as part of the whole of government approach. The project behind us is actually a key component of the PETA plan. And as you know, one of the commitments that was made by the fifth administration of His Excellency the President, Dr. William Ruto, was actually universal health care. And for this region, there was a commitment to actually establish a cancer center of excellence, a cancer center for research that will then be used to actually help support our people. As you have heard from the medical practitioner himself, the PS for Health, cancer is now becoming a pandemic with the high numbers affected across the villages and across the country. And it's actually a big blessing for Kisii County and this region of Western Kenya.
My name is Professor Graham Lord and I'm representing King's College London, but also the Kenya UK Health Alliance, which was established by presidential mandate that has been supported by your current president. One of the very early missions that we had was how do we help to address the problems of cancer care in Kenya, how to deliver cancer care and research close to local people where it's most needed. So this is about my third or fourth time in Kisii County, and it's really exciting to see this whole of government approach to deliver fundamental cancer care delivery for the people of Kisii so that they don't need to travel to other centres. And really, on behalf of the British government working in partnership with the Kenyan government, very much one of our first projects was based here in Kisii County. In fact, much of the origination of the idea of the partnership came from Kisii County.